recording has begun. Okay. So we will go ahead and jump in here in just a moment. Please jump in at any time if you have a question, because I am so focused on what I'm showing you guys. I'm not necessarily monitoring if somebody raises their hand or anything like that. So please just unmute yourself and interrupt me and ask questions. This is ultimately for all of you guys. So um, I'm walking you through the functionality of how Benefits 24/7 works, but this training is for you. So please ask any questions that come up along the way, and we are happy to facilitate that. So I'm going to give a quick overview of what we're going to touch on today. I anticipate, based on how things went in this session earlier this week, that we will probably wrap up with about 15 minutes to spare. But depending on how many questions and things, we should probably take most of, if not the whole time. So we're going to be looking at transfers and terminations, and then terminating and re-enrolling somebody. We're going to look at viewing the wellness indicator and potentially updating if we need to do so, and we're going to see where we see that in the system. We're going to go over submitting and verifying an SOE. We're going to look at correction events because we don't have account corrections. We're going to talk about where we can find contact information for organizations and how to encourage folks to add those contacts. We're going to touch base on locally eligible for SEB because that is different than how it's currently functioning in SEB My Account. Also, the first day of school for SEB, that again is different than how SEB My Account currently works. We're going to review some reports, and then our subscriber history or audit report. We can go into a little bit more detail on that today because it is functioning as opposed to how it was looking last week. And then we'll also touch base on how to make an update to attestations. So any questions, comments, feedback, anything before we dive in? Okay. We shall get started then. I'm going to go ahead and log in, and we're going to start out just with a transfer here. You'll see that some of the things we're going to review, transferring and terminating, are pretty straightforward, very similar to how we're used to seeing it in SEB My Account. But I still feel like there's value in walking through, since ultimately Benefits 24/7 is different. So I'm going to search for my subscriber here and manage them. And then before we jump into the transfer, I want to take a moment to acknowledge how it looks a little bit different here than maybe what we saw last week. Last week, we were really focusing on adding brand new subscribers and walking through that newly eligible wizard. And here you can see, now this is not a very accurate representation of how it will look going forward, because we're not going to have two open enrollment periods on a subscriber dashboard. However, because we're in the system as HCA, we do see the prior newly eligible wizard all the way back to their initial eligibility period. And then we would see the most recent open enrollment period as well. So we wouldn't see this newly eligible period if they had had some kind of change to their eligibility, some kind of change to their agency. But we'll see that here in a moment, as I transfer this person to a new organization. but wanting to acknowledge that this is one, only visible to HCA because these are events that happened well in the past. And two, if either of these events were, of course, during lower limit time frame, then the benefit admin would also be able to see them. So anytime we need to make changes, especially kind of those retroactive changes. Um, First and foremost, we use our wizards if those are the applicable places, and then if not, we would move to a correction event, which we'll look at a little bit later. So wanted to acknowledge why we're seeing some new information on this account versus what we looked at last week. And this is really because somebody was eligible in the past and they've not had a change to their employment or eligibility since that initial enrollment. So I am going to jump in to transferring them out. So I'm going to go to their eligibility page. And I'm going to copy this for myself so I can make it easy. And then uh, again, this is a little bit different from SMA. SMA has terminate and transfer in separate fields. So this is all combined into one because I know we did make it better in SMA so that people couldn't do a terminate and a transfer, but it is a little bit confusing to folks. And so we moved it all into one field and in the drop down, which again, I know you guys can't see the values as I'm presenting, but in this drop down menu, you can actually see transfer is one of the options. So in addition to the valid termination reasons within this list is transfer. So I'm going to go ahead and select transfer here. Once I select the reason, of course, the date field populates and we're going to go end of February here. And once I've put in my reason and my date, then I can submit those changes. So here, once we have completed that transfer out, we actually see this cancel transfer button. Now, this cancel transfer button is only going to appear on the same day in which you've completed this transfer out. So if I was in benefits 24/7 and I went in and transferred Debbie out and I did it yesterday, and I went back to her account and I was like, oh man, I did that. And then she came back to me and said, in fact, I'm not leaving, I'm staying. We wouldn't see this cancel transfer button anymore because um, that actually, okay, let me back up. The cancel transfer button is available within the same day only because we haven't yet sent that information over to Pay One. So much like many of you are familiar with how we would key that in Pay One, we for PEB, we do a 401 and we do the transfer out date. And then to transfer them into a new organization, we do the 201 with the new agency effective date. Well, if we haven't already sent that transfer over to Pay One, then we can go ahead and cancel it as if it never happened. But if we go in the next day, so benefits 24/7 at over that night has sent over to Pay One the valid codes in through our file that we give to Pay One to process enrollment changes. Now we would be able to see that 401 with the transfer out date on the 41 screen. So we wouldn't be able to just go in and say, never mind, because that account in Pay One is already sitting in that transfer out state. And unfortunately, we don't have a way to send something to Pay One that says, never mind. So that's why the cancel transfer button only exists on the same day in which the transfer out has been done. If there is an issue and the words are very hard for me today. I apologize, you guys. Um, if we need to make a change after the transfer and it's the next day or the next week, and in fact they're not going to be transferred out, we would come in and we'd actually want to change this to a termination, and then we'd re-enroll them the first of the following month. And so that way the correct information would get to pay one and appropriately continue that enrollment for the member.
Hey, Amanda, I have a question.
Yep.
So we're not talking about a 24-hour period for that canceled transfer, just till midnight they
Yep.
can
Yep.
do that.
We're talking about the same calendar day. That is a very good point. Thank you.
So whether you transfer or terminate them, the other organization can pick them up,
Yep.
correct?
That's
And claim
correct.
their
Yep.
account. Okay.
Yeah.
All right. Thank you.
Yeah, absolutely. All right. So I have submitted my transfer. Recopy that just in case. And then I'm going to go pick them up with a new organization here. And for fun, let's go to ecology. So go to my manage subscribers, add new subscriber, enter their SSN, put in my date of eligibility, and select next. Now it gives me the message, we have found this subscriber before and I can claim. Much of our information here is auto-populated. If we need to adjust, we can make those adjustments. Otherwise, we can just go ahead and submit. So now, if I look at their account again, you can see, as I mentioned before, that newly eligible wizard is no longer available because now we've had a crossover into a new agency. So we can't go back and make changes through the wizard back to their original eligibility period because we've had a change in agencies. All right. Any other questions about transferring? Pretty straightforward here. Okay, let's go on to our next scenario. I'm gonna go back and search for my subscriber. And first and foremost, I am going to show you guys terminating somebody as never effective. So we know that, I don't know that it happens as much in the PEB side. I know how often it happens on the sub side because I see that data in SMA. And this was an opportunity that we were able to make a big improvement in benefits 24/7 from how it's working in SMA. And that's because in pay one, and again, I'm going to, you know, cross reference all of our versus SMA or how we do things in pay one. When we terminate somebody in pay one as never eligible, we have to terminate them with the effective date matching the agency effective date, right? So if their date of eligibility was 3/1/23, when we go in to terminate them and we do the N31, we also have to put in the 3/1/23 date. So those dates match, and then pay one will terminate them as never eligible. So we know on the SMA side, we're not sending the information to pay one in the manner that would terminate them as never effective. So we, lesson learned, fix that in benefits 24/7. So in the case that an individual was never eligible for benefits, we would come in here to the terminate section, and one of the options is employee never eligible. So when that option is selected, then we don't even need to put in a date because we're telling the system that this person should not have any enrollments. We need to cancel them as if they were never enrolled. So we select that reason and we submit changes. And here then we see that benefit end date is populated as 3/1/23, which matches that original date of eligibility. So they will be terminated as never effective. Questions about that? All right. We'll go on to
Amanda, is
something.
there a time
Yes.
limit for that action?
Um, well, for HCA, of course, there's not. And on the benefit admins, I do have a takeaway note to double confirm that that shouldn't be available outside lower limit. It shouldn't be. But we did have that question in our earlier session this week, and I just don't quite have the answer yet. So I will make sure that we get that answer and get that sent out.
Yeah, I think that probably violates one of our policies.
Yeah.
Okay,
Yep.
thanks.
Okay. So now we're going to look at rehiring. So terminating and rehiring. So I am going to select my subscriber here. And I'm going to come in and terminate Tommy. And I am going, nope, not never eligible, wrong option. Okay. Employment ending. I'm going to do the end of February because I want to show a couple of things here. So I'm going to go ahead and submit. Let me copy my SSN.
Amanda,
Okay. Yep.
I have a question on that. I've never really done terminations in Pay One, so I'm curious about that termination effective date. Is that the last day they worked with their employer, or is that the last day of their coverage ending, like, for their coverage?
That would be the last day with their employment, right? So you can see here that this additional field populated benefit end date, and this is
Okay.
not editable. So if I was to put in 215, right? That's or 214. That's a common uh, state agency date, right? If I
Mhm.
put in 214, it would still populate with the same benefit end date, which would be 228. So
Okay.
you can input whatever date that the member was actually terminated, and then benefits 24/7 automatically knows that the benefits in the last day of that month.
Okay, thank you.
You're so welcome. All right, so I have completed the termination on Tommy here. Let's go to, well, just for fun, we'll go to Healthcare Authority. And so Tommy was terminated 228. So if I go add new subscriber, and I'm gonna show this two ways. So I put in the SSN, and then if we say, I did this, do this. Oh, one. Can't type. Okay, so first of the month following, right? Subscriber record previously found. There's no break-in coverage here. We know that, and in fact, if I come to this page, you can see that the coverage effective is 3/1. There's going to be no break-in coverage here. So they're just going to be re-enrolled. They're not going to have an opportunity to do their newly eligible. I'll show you one other thing. If I was to actually say, let's just say today's date, because this is a PEB organization, we get our subscriber record found, we claim them. Here we see that coverage is effective 4/1, right? Because that's an actual break in coverage. With the date of eligibility of 3/24, it is not a valid transfer for PEB. And so this person is actually going to be newly eligible. We need to update our eligibility reason. And so I will just go ahead and continue through this. mailing address and submit. And so now if I look up Tommy, we have that newly eligible wizard. I will say these ones showing is the bug that we already have identified and is not happening and will not be happening when Benefits 24/7 goes live. But we do have that newly eligible wizard for coverage April 1st. Any questions about terminating, never eligible, terminating and rehiring?
Hey, Amanda, if you had like a 2-month break in coverage, would their newly eligible tab show up 2 months later? Once you add them in, regardless when you add them in?
So you're adding somebody well into the future.
Yeah,
So you're not going to be able to add folks that far in the future because of invoicing dates and things like that. So we do have a restriction on how far in the future you can add somebody. But you have an opportunity, right, to add somebody right now. Let's just say they have a 4/1 date of eligibility. In the case of Seb, that coverage is effective 5/1, right? That newly eligible wizard would be there, but remember, subscribers can't get in and make their enrollment elections until their date of eligibility. So a
Correct.
BA would be able to see that, but a subscriber would not be able to log in and actually do anything until they were actually eligible.
Okay, perfect.
Yeah.
Amanda,
Okay. Yes.
I have a question. What if an agency keyed an employee as a transfer out, and the new agency picked up the employee, but it wasn't as a transfer in because they determined the person's eligibility, let's say May instead of March.
Mhm.
So what will happen if it's coded transfer out under the previous employer in for 24/7 as well as pay one, because two agency cannot take the same, have the same account in pay one, right? But do they have two different account in 24/7, or would there be a flag that said, hey, this person has a transfer out
Well,
as
so
of February 28th?
right. So there is so we have a report for outreach and training to work for pending transfers. And I don't necessarily know the process on how that is worked, but that report should be worked every month to make sure that anybody who's in a transfer out status and their transfer window is no longer applicable, they need to be terminated so that when a new organization comes in and picks them up, in your example, if somebody has a transfer out at the end of March, but they're not picked up to until May, but it wasn't resolved to actually go back in and terminate them, the system isn't wise enough to say, because that's kind of a human level of understanding, right? If they're transferred out with this date, but somebody comes and picks them up here in May, all the system knows is, hey, they're sitting in a transfer out status and you've come and picked them up. So that's why it's really important that we have that pending transfers report. I know is looking to see, and she's not in here. I know Sonia Marie works at quite a bit for outreach and training on the sub side, but it is part of kind of operation practice for individuals.
So in the meantime, though, when the person is in their transfer out, no enrollment information for the employee and their family member is reported in the carrier report, right? It will just
However, the current practice happens, right? So they would So my understanding is when somebody is in a transfer out status, we have not sent a termination to the carriers. They remain enrolled, but they're also not being billed, is my understanding. If I'm incorrect, please tell me. But that's why it's important for that report to be worked just as is current practice. And things happen, right? But that's why it's important for those things to be looked at and make sure that people are being appropriately terminated if they have not been picked up in the allowable time frame.
Yeah, that's the reason why I'm asking, because within the 24/7 platform, my understanding is that the enrollment is coming to the carrier directly without going through pay one billing, the pay
Yep.
one. So
Yep.
the billing is going to be totally separate from that. So right now for ACA reporting, when there is a transfer out, since it's not being billed, we do not get enrollment information because invoice doesn't know who to bill it to. So therefore, we don't get that data until the transfer is in and where the invoice is being billed to the correct agencies. So that's the reason why I'm asking, is that since it's split, enrollment goes from 24/7 versus going through pay one for invoicing. So that's my concern, that we're still on 24/7, we're still sending enrollment to the carrier and even though they may not be eligible as of February 28th, because the new agency is not going to pick them up until May. So then once the report is worked, based on what you're saying, then all this retroactive changes will then be sent to the carrier, I'm assuming.
Yep.
Yeah, thank you.
All right. Let's look at that wellness indicator that I mentioned earlier. So we're used to being able to see that in pay one. Of course, we've never had that information in SMA for folks, but we are used to being able to see that wellness indicator and a date on the 44 screens in pay one. So in benefits 24/7, if we go to our subscriber account and we go to the eligibility page, here you can actually see now this new field for wellness participant. So we do have the feed that comes from our smart health provider that gives us that information that says, this person qualified for the wellness and this is when they qualified. So we will have that information being automatically fed into benefits 24/7. But in the occasions where we maybe need to make an update or provide that information for whatever, I know that there are cases where we need to do that. We can actually come in here and change this wellness to a yes. And the effective date will be automatically populated to today, but we can change that to the applicable date. And then it will show us what that plan year is. And so that way, come December, when we send to the carriers for open enrollment coverages, this individual would then have that W applied to their medical plan and get sent to the carriers so that they're aware of the wellness enrollment. So if we needed to make an update to that, change from yes to no, or a no, yes to a no, or a no to a yes, however you may need to update that. And then it's just a matter of hitting submit and that's all. But really wanted to point out that once once benefits 24/7 is up and running, mainly the main part of this that I wanted to point out is when you go into a subscriber and you go to their eligibility page, you can actually see that wellness information. It'll be automatically populated here.
So Amanda, is this updated annually by HCA? And if it is, then employees that are hired during the year, this won't happen for them?
So we get that information. Currently, Limeade is uh, what's the word I'm looking for? Is the
Vendor.
vendor that provides the smart health benefits. We get a feed from them in December, and then I believe we get what's considered a catch-up file in January, where we apply those wellness, oh my gosh, apply that wellness information on subscriber accounts at those times.
So employees that are hired after that, like May or June, that won't be updated till December for the next year, right?
Yeah, that's correct.
Okay. All right.
Yep.
Technically,
right.
though, just as a note, HCA can update that at any time if they need to. But the feed will come over December and January, like Amanda noted.
All right. So now I wanted to look at special open enrollments. So again, here you're going to see the tile itself has a little bit of a different name. So special open enrollment and account changes. So if we go to this page, you can see that there are actually two sections. And up here, there is some information, one about special open enrollments and two about account changes. So if any of you were here at the session earlier this week, I apologize. I'm going to give you my same spiel again. We did a lot of discussions with Amy and rules folks about SOEs, specifically death and divorce. And if you read the 45-2A and you see under all of the applicable actions of adding a dependent, making plan, being able to change plans or waive your coverage, any of those options, it tells you on the matrix that it's not a valid SOE. And so I worked a lot with Amy to understand what does that mean and why why have we had that? Why is this on the SOE matrix if it's not a valid SOE? So what she told me is it's not an SOE. Yes, they need to tell us, but they just need to tell us as soon as possible. And it's not an option for these folks to continue coverage, right? So we broke out the death and divorce option into an account change. Of course, I can't show you in the drop down because you guys can't see my options, but two, this account actually doesn't have a spouse or any dependents on it. So I don't even have that option in my list. So the death or divorce is only going to display in this drop down if there are any dependents on the account. So with that being said, I'm going to come back up here to the special open enrollments. Of course, we have all of our special open enrollments listed in here, becoming eligible for Medicaid, birth adoption, change of address, continuity of care, et cetera, et cetera, et cetera. Before I select one and walk through, I want to acknowledge these other two fields here. So we have the event date, which is something we're used to. Select the event and put in what the event date was. We as HCA also have this additional field here for coverage effective date override. And one of the biggest heartaches that I certainly have felt in SMA, and all of you have felt as well, is we don't have the ability to actually change the coverage effective date if, let's say, we got an appeal, right? We get an appeal and it's approved. We need to go back and change the date. We're having to use account corrections. And so we created this coverage effective date override field in the case that, maybe the event date was, let's just say 2/1, but we go in and put in the request today. It would give coverage effective 4/1, right? Because the coverage is effective the first of the month following the later of. And so but what if really the coverage should have been effective 3/1 or even 2/1, but because of the, because of the scenario, whatever the case may be, we have that opportunity to do the effective date override. An additional note, the benefit admins do also have this field, but only within lower limit. So they could also, in the case that, let's say somebody was still using a paper form, and based on what the actual date of the event was, if we were to put it in, it would be the later of the date submitted. And so if we needed to put the correct coverage effective date, they could do so. So with that being said, I'm just going to go ahead and add a baby because that's always the easiest one to do. You can see here, once we select the event, we get information about what the event is. And then this is something that communications included, and I rather like this, what documents you can submit to validate your event. So we'll select the event and we'll put in the event date, and I'll just go ahead and say March 13th and add new event. So again, this wizard is going to feel very familiar to how the newly eligible looks. So we'll walk through this. I'm going to add a dependent here. And then of course, we'll walk through adding this information. Birthday, I have a little girl. Qualify reasons automatically selected based on my relation and the date of birth. I'm going to select that they don't have a social because we're still brand new. And my address is the same. So it's going to take me to adding coverage for my dependent. We're going to go ahead and add them to medical and dental. And here you're going to see that there is a new field, a new checkbox that populated. And this is for an adopted dependent, because we do know that the SOE event is birth or adoption. And so for a newborn, we know that coverage is effective based on their date of birth. But we also want to make sure that the same thing applies for an adopted dependent, because it's not going to be the date of birth, right? Because they could be 10 years old, but we want to make sure that their coverage is then effective the same as the date of the event. So if this was to be an adopted dependent, we'd want to select that checkbox to make sure their coverage is effective when they're adopted. All right, and it does provide that information here in this text. So I'm going to select to proceed to dependent review. You can see up here in the grayed out sections, we skip right over attestation. Since this is a newborn, we don't even need to try and capture it. So we don't even force them to go through that. And then we can review our information of who we've submitted. We've selected to enroll them, and we're going to save and finish. Tells me I've successfully added my child. And is there anybody else to add? I'm going to go ahead and say no. And the reason we have this additional review is because if you had walked through that dependent portion and added several different dependents, of course, then you'd want to review all of them and see, just to make sure that all of the information is correct. The users have an opportunity to go back in and edit that dependent information by selecting this edit dependent hyperlink here. And then it's going to ask them to walk through uploading documents. So we can just go ahead and select a file. Where's my blank birth certificate here? So I would select the document type from the drop down. It's only showing valid documents that would apply to this SOE event. So we have adoption decree, birth certificate, a declaration of tax status form, placement letter from adoption agency. So I'm going to select birth certificate here. And I'm going to apply this document to my my child and for the SOE event. So this is the first section here is dependent, and then this is for the actual SOE event. And that would be, you know, in other SOEs, if they were adding a dependent, but also needed to, like, let's say they had a loss of other coverage, they would upload an additional document and they could apply it to the SOE a termination letter, for example. That wouldn't necessarily be dependent verification, but it would apply to the event. So once we've done our documents, we say upload and confirm. And now we're going to proceed to coverage. Here we have an opportunity to make a change to our medical, of course. I'm just going to go ahead and remain enrolled in the same plans. And then we have a review page here showing that we have enrollments, what everybody is enrolled in. Confirm. And then it's going to walk us back through the tobacco surcharge. We just say no. Confirm and review. So now we have our summary of coverage elections here. Gives us an opportunity to review that. And then we confirm. And the last portion, again, that SOE does need to be submitted. So of course, in much bigger letters here, we tell them, please submit your SOE. And so then we can go ahead and submit. Once it's been submitted, we now see that event in the grid here. It tells us what the event date was, the deadline, that's 60 days. And if we select the event, the user can actually cancel it. So then they could make another SOE if they needed to. Maybe something was wrong with this. Also have the opportunity to download the PDF. And so it does say down below, you cannot create another SOE event until the current event has actually been verified. So this prevents them from submitting several SOEs, maybe the same one over and over. We had that issue in SMA. So once, if they do have two overlapping SOEs, they would need to have the first one verified, and then they could submit the next one.
Amanda, I have a question about that.
Yep.
Two questions. So when they, let's just stick with like the newborn, they've added the child. I didn't see an option to do related special open enrollment events like, you know, increasing an FSA or enrolling in DCAP, you know, which would be allowed. So does that come after this?
Those are not done within the system, right?
Okay.
So FSA, DCAP, any of those ancillary benefits, those enrollments continue the way that they already are. Typically, you know, Navia has a portal that folks can go in and enroll, or, but yeah, it's not done through benefits 24/7.
Okay.
All right. So I am going to just walk through the verification. It should look familiar, but we should do our due diligence of reviewing all of this. Okay.
Hey,
So if
Amanda,
I go,
can I ask one other question?
of course.
If I wanted to change my carrier relative to the birth of the child, did you have that option when you went
Yeah.
through adding the newborn?
Yep.
To
So
save
we
or
walked
change?
through the medical
Okay.
coverage and the dental coverage. If it was sub, we would also have the vision. We'd have the opportunity to make changes to any of those
Okay,
coverages.
thanks. Sorry, I
Yep.
missed that.
No problem. I did go kind of quick, so thank you for asking. All right, so I am on the dashboard for the organization that our subscriber is eligible through. So I'm going to go to my special enrollment verification queue here. And I see now my subscriber, I see the event, I see the effective date, what the actual date of the event was, when it was submitted, when the event actually expires, and if any documents are attached. So I'm going to go ahead and select this event, which then populates it down below. And this verification portion should look very familiar. Our typical verify, deny, pending options here. We have some information about what changes were made as part of that SOE event. But one thing I did want to point out, and here's where I can show you, James, in regards to your question. This edit request functionality is new. So one of the struggles in SMA is if something was wrong with an SOE or we needed to go make a change, we have to go back to our managed subscribers, get this subscriber, go to their SOE page, go into the SOE. There's a lot of steps, and there's a lot of distractions that could happen in that amount of time. So what we did here is added this ability to just edit the request for the BAs or HCA, obviously, right here when we're viewing the event. So let's say, how real this is, I don't know, but let's just say the subscriber came to me after the event was already submitted because they cannot make a change at that point to the event, and they say, oh my gosh, I'm so sorry. I submitted my SOE and I meant to change my medical plan. I really need to change my medical plan. I want to be in whatever plan, right? So then the BA can come in here and they can edit the request. And now it takes us directly into that special open enrollment request that the subscriber already submitted. So kind of like a pop-up on the screen, and it takes us right into that SOE wizard. So we know in this case, there is no additional dependents to add. So I'm just going to say no. We review that dependent that's already been added. We see the document upload page, and we can just move past this. And now we see that medical plan coverage. So they came to us upset, wanted to change their plan. In fact, we wanted to go into, let's say, Kaiser Value. So we can select that medical plan and hit next. Update dental if needed. If not, just leave it the same. Hit next. And then now we can review and see, yep, we have that Kaiser Value plan. And then just move through the remainder of the wizard here. Shouldn't need to make any changes. I'm going to go a little quick. We have that review. Now we have that Kaiser Value plan. Select next and confirm, and then submit. So now, as soon as we make that change on behalf of the subscriber, we can see that we have a new line item here, changed medical plan from Kaiser Sound Choice to Kaiser Value, and with the effective date. So then we can just go ahead and verify. And we got a birth certificate. The verification documents works just like SMA. We can select any one of these, anything that's been uploaded. So I'll select my document type as a birth certificate, and I will submit my changes. So now that SOE has been verified, and we can see that information changed up in our grid.
Amanda?
Yep.
When you make that change on behalf of the employee, how long before they can be able to see that on their side?
As soon as it's been submitted.
Okay, so it couldn't be the same day.
Oh, yep. It's so things happen in benefits 24/7 instantaneously, right? So as soon as something's actually been, let's say I'm the benefit admin and I go in and update an SSN. As soon as I hit submit, the subscriber could log in and see that change. It's instantly.
Perfect, thank you.
Yeah,
Amanda, I have another question.
of course.
You said the death under the SOE, which isn't an SOE, right?
Right.
There's no time limit to that, right? They don't have 60 days to report. And if they report it like 4 months out, Will accounting reimburse them for that time, the 4 months that they didn't report it?
We don't have a time frame on it, right, Jeff? The death and divorce. See if he's listening to me.
The reason why I'm asking, because we talked to an employee at one of the colleges and they were still mourning and didn't never report it. It's been like 3 or 4 months. I was just wondering if there's a time frame and would she be reimbursed for the months, since he passed?
So, care if I answer that in a minute? So there is no time frame. You can come in and report a divorce and you put in the event and whatnot. But HCA, accounting, error correction, those folks are going to decide exactly whether or not we go retro. If so, how much? All of that stuff is going to be decided by HCA. So that's kind of a separate piece, but you can report it at any time. And the one thing that we do gather at that point for, say, a divorce is, were we notified within 60 days? There's that indicator that you see in Pay One. We also ask that question here, and that's associated with your COBRA packets going out. So does that help?
Yeah, so if they weren't notified within 60 days, then they won't be reimbursed, you saying?
The policy, we have policy 19-1A that already covers this scenario. And they would be terminated the last day of the month of death?
For death, yes. Divorce, different. If my understanding is correct.
Yeah, and that's
Robert,
all
you were
business.
talking about death, right?
Yeah.
Oh, for a death will definitely terminate coverage at the end of the month of death.
And I just have another question with dependents that are denied. How is the subscriber notified that they're denied if they don't go back into Set My Account? Is there something notifying them?
There is not, though, same as current practice. It would be on the responsibility of the benefit admin to let them know.
Okay.
Definite opportunities for new things in the future. I know we've had many conversations and we do have that ability for notifications logged as enhancements for the future. So more to come down the road on that. I don't know when, but we do have that logged.
So since you're talking about divorce, how does 24/7 handles where an employee, let's say myself, have a husband who I had terminate coverage as of December of 2021 through a annual open enrollment. And then let's say now in March, I actually back in 2022 of April, I divorced my husband, who I removed from coverage, and now have a new husband I'm marrying and wanting to add as of March 1, 2023. So with that scenario, how am I able to, does the system just, when I go in there, can I just add my new spouse because it's not showing that I have a husband enrolled? Or is it going to see that, oh, you have a current husband, but the coverage terminated, and it will require you to do a different, and is it an SOE event or to remove the ex-husband before I can add the new husband? How does the 24/7 gonna tell me what steps to take to add my new husband?
So you removed them from OE rather than doing a divorce event. Is what your
So
scenario was?
so if I'm still, so in the system, it's just right now, it's just showing that I have my husband coverage ended as of December 31st of 2021. That's what it's showing in Pay One and 24/7. And now I go in because I'm married. I didn't tell my payroll or anyone that in May I was actually divorced. And now I want to add my new spouse. What is the step to take? When I go in, log into my 24/7 account, um, how does how does a member like myself be able to add that new spouse? Does it say when I try to add a new spouse, would it flag me saying, "Oh, you already have a spouse on. You need to remove the spouse before you can add your new spouse." Is it going to give me that message, or how does that work?
Jeff, do you have a good answer for that?
Maybe. So if I'm understanding correctly, you had a spouse, you removed them in open enrollment, so you didn't actually report a divorce, but you just removed them. And then later, May-ish timeframe, you got remarried. Is that understanding correctly?
Yeah, so it like, so during open enrollment for during the open enrollment for 2022, I, at that point in time, was still married. So, but I didn't want coverage for him, so I removed his coverage as of December 31st, 2021, because I don't want him to be covered in 2022.
Sure.
Then in 2022, life happens. So we got divorced in May of 2022. So in my mind, I didn't have any coverage for him anyway, so I didn't feel the need to contact my benefit administrator, say, hey, I'm no longer married to my spouse A. And then during that time period, I met my spouse B, and now we got married in March 1 of 2023. So now I'm saying, oh, I need to add my spouse for coverage because he needs benefit. So I go into 24/7 wanting to add, which is a special event, is that I got married, right? So I got married on March 1st, and so I want to add my new spouse. So when I go into 24/7, if I go to special open enrollment thinking it's a married, would it tell me that I can't because the system's still showing that I'm married to my spouse A, even though he's not enrolled?
Your spouse A wouldn't be showing on your account anymore, I believe. Once the coverage is ended for a dependent, we have a relationship end date that applies to the coverage end date, and then they don't appear anymore. The real issue on the fact that you didn't actually remove them through the divorce process is that we didn't. So if you're familiar with Pay One, we didn't update that subscriber's marital status to single, and we did not put in a divorce date at that point in time because we didn't have any reason to. So that would be something that we would need to probably fix at that point. And then that would probably be, since it's that far back, it would be an HCA correction to actually remove that spouse correctly to get that single status with the divorce into Pay One. If you didn't do any of that and then you just went in March and tried to add a second spouse, you would be able to add a spouse onto that account. The other one would be gone. And then technically it would probably work since the marital status was still married, because the marital status isn't really tied to a particular spouse, it's just tied to a spouse. So I would say if I were to do this as an HCA employee, I would want it to be real clean. So I'd probably process an actual divorce to make sure that we got that marital status changed. And then in March, if you didn't do any of that or you did, it doesn't really matter. But the BA, since we will allow that person to enter, technically you could have two spouses listed on your account at once. And the reason why I say that is because let's say we did it right now and I got divorced today. My spouse's coverage is going to end at the end of this month. So they're going to be shown on my account until the end of the month. But I could get married tomorrow. Now, as rare as that might be, it could happen. And so we'd allow you to add that second spouse as long as the coverages did not overlap. Then we would be okay with that. And we had the first one being removed for divorce. So it's a little bit of a weird area there because we do have to allow that. Otherwise, we would have to wait until the coverage was ended for the current spouse, and then you could add the new one. So you'd have to wait a little bit of time. But we do rely on benefit administrators in the cases of something like this to say, well, you can't have two spouses on your account. So I need to go contact the employee, get really clear about what the scenario is. And then can I put this person on and actually enroll them? Or do I need to deny that request and adjust how it's all done? I don't know if that really helps explain that to you, but the answer is, yeah, you could put two spouses on your account at once, but we're going to rely on the details of the situation and the people who are processing and their knowledge to make sure whether or not that's okay. With again being that spouse was removed in open enrollment and that was done technically incorrectly. You should have used the divorce.
Okay, so the reason why I brought up the scenario is because we're having difficulty getting correct data for AC reporting when there is two, the relationship status in Pay One is still showing that there are two spouse, even though one is no longer enrolled. So so in order for us to get the correct data, the one that it's, so there can only be one active relationship of spouse. The other one would have to be an ex-spouse with the pending term. So yes, technically you have two spouses, but one has to be an ex-spouse and the other one has to be the actual spouse. It cannot have two spouse in there. So so we were having a lot of issue with Send My Account bringing in over like two spouse, sometimes a spouse and a partner at the same time. And then our pay one extract is not giving the right data for us to be reporting for our 10F5 reporting purposes.
So
So
Tila, I think what we could do is we can provide you some additional information after the training. I want to make sure we try to get through the remainder of the things on our list today, and then we can circle back around with you and provide additional guidance on that if that would be helpful.
that's great. Thank you.
Thank you. Any other questions about SOEs?
Amanda, I didn't have a question. I just had a comment. Great job on this new wizard. A huge improvement from Set My Account. The colors actually stay in the boxes, so great job on that.
And I know the team who originally designed it is before my time on the project, but they wanted to try to emulate the feel of like a TurboTax, something that's friendly walking you through. So if you notice a lot of the messages, instead of saying like boring old submit or continue, it's like, hey, let's go to the next thing. Let's do this. And so thank you for that, Robert. It's really kind.
Yeah, I'm just impressed with the color. Once you complete that step, it stays and you move to the next step instead of, I've already completed that. Why isn't it green still,
Yeah. I definitely know what you're talking about. Okay. I wanted to take a look at what this whole correction event means. So here we have an individual who was eligible all the way back in early sub days, their coverage was March of 2020. And whatever it may be, we got an appeal. It took a really long time to come to fruition. Whatever the case, things happen all the time, right? But let's just say for this individual, we got notified that we need to add a spouse back to, let's just say, September of 2022. Typically, what we'd be able to do is find the applicable enrollment period and make the changes. So if it was something from an open enrollment period, we could go back into that open enrollment wizard, make the applicable changes, and go on with our day. But there are circumstances that come up where we have something where we need to make a change that's outside of one of those enrollment wizards. Referencing the user manual, we did outline the steps, the actions that you would take before you went in to do a correction event. But we're going to go ahead and start one of those correction events so we can take a look at what that looks like. So it is in our special open enrollment account changes section. And in our recognizing it's not actually an SOE event. I do acknowledge that, but it is in the list here, HCA OE correction. We would want to put in the event date. So for this case, I told you we're going to add somebody back to September. And this is a very good example of when we would use that date override field. So I'm going to go ahead and say that the coverage should also be effective September 1st. And I'm going to add my event. So this correction event, it's the same wizard that we've seen all along the way. And like I said, referencing that user manual will really help you understand when and how you should utilize this correction event. But for today's purposes, we are going to add that spouse. So I will move through this pretty quickly so you guys don't have to see me type too much. All right, and we have that spouse and that partnership start date, September 1st, married spouse here. Enter our social security number, and they have the same address. So now I'm going to move to adding coverage. Again, this should look and feel very familiar. It's the same basic wizard that we're using all throughout the system. Same as newly eligible, same as open enrollment, same as SOEs, right? Everything just has a little bit of a different flavor based on, what we're doing. So we know that this individual should have been added to medical, dental, and vision. We move to our tobacco attestations, no, and then we're going to continue to our spousal attestation. We're going to select the applicable answers here. This person said no to question 6, so then we're going to continue and proceed to our dependent review. Here's our spouse, the date of birth. We are enrolling them medical, dental, vision, no surcharges. I'm going to save and finish. All right, I've successfully added that spouse, no other dependents, so I'm going to move forward. Because this is an HCA event, first our dependent review. Make sure everything looks good. We can go back into edit if we need to, if something was incorrect. And then moving on to the next step, because it's HCA doing this, we don't need to upload a document. I'm certain we would have gotten them in another venue. So we can proceed to elect coverage. We see here they're enrolled. This shows the subscribers enrollment already, and it's showing us this coverage will be effective September 1st. So if we needed to make a change to that medical coverage here, we could. I am just going to go ahead and add them. So I'm going to select next. Again, no change to my dental coverage here and no change to vision. And then now we see that spouse has shown up with a coverage effective date of September 1st, and we show the applicable coverages. Firm. Move through our tobacco surcharge. We don't need to make any changes necessarily, but we could if we needed to. And then we go to our confirmation. So here you can see now we have that spouse added with their effective dates of September 1st. Plans, the same summary of coverage elections that we've seen before. And then we just go ahead and we can confirm. So now that it's done, we just go ahead and submit. So that is more or less how you do a correction event. And then Jeff, these must need to get verified. Is that correct? Yes. So it would be in our HCA SOE request queue. And we just come in here and select the event and verify. I am 99.5% certain we do have a logged enhancement request that when a HCA user is submitting a correction event, that it will automatically verify. By the time we go live, I don't believe that functionality is going to be there. So we would need to take the extra step to come in and verify the event just so that everything will be applied appropriately. But we do have that logged so we don't have to complete the verification.
Hey, Amanda, this is April. Can I ask a quick question?
Of course.
So what if there had been an open enrollment plan change in the interim time? How does that feed over to pay one? So if they were under like UMP Achieve 1 in 2022 and then they changed to UMP Achieve 2 for 23, can you tell me how that feeds over to pay one?
Yes. So Jeff, correct me if I'm wrong. We do the correction event, then we go back into the open enrollment wizard and make that plan change. Is that correct?
What's the effective date of this correction you're doing?
This was back to September 1st of 22. Then they had a plan change for January 1st of this year. We'd want to go back into that open enrollment wizard and then make that plan change. Is that right?
Yeah, essentially, when you're going to be making corrections, if we have to go jump, I don't know if this is the right terminology, but you will have to jump back into the past in benefits 24/7, which we can do that. But for pay one, it's a little bit more difficult. It could be, depending on the scenario that you're using, that we'll have to have a combined correction where you have to CI something backwards in pay one to prepare to receive the correct records. But if you're going back to change something for, let's just say, September of 22, but they had done like an OE change or an SOE down the road, and you're correcting something before that, we're going to have to go through benefits 24/7 and quote, rebuild that account. And then we've got it sequenced out to where it will feed those records over on subsequent sync files the way that we know Pay1 can accept it. But if you're going back and kind of changing Pay1's history and removing some things that have happened subsequent to what you're feeding it, you will have to make those adjustments. Like Amanda said, again, you'll have to go back into the open enrollment, change it back to the plan that they chose there, if that helps.
So for this account, we prefer that less CI action and pay one is the best. So if you can be able to rebuild 24/7 back to the previous plan to add this newborn, and then go back in after it has been transferred over to, I mean, I think under the pay one system, currently, I think April, I think they are having to go do some Jigger CI action on pay one to get it carried over, I think.
Yep.
So is that correct, April? Is that what you're currently doing for my account? When said my SMA is not matching with pay one to get it saved over
Yeah,
correctly?
you have to get, you stop SMA from sending any updates to pay one. It's like a 4-day process to correct a sub account, because you have to stop it from sending any updates to pay one, go into pay one each day, do the steps in pay one, and then tell SMA, okay, it's cool, you can start sending stuff over again. So
So it sounds like this might be the similar for the 24/7 for this type of scenario.
So
Well,
I will say that you know it's we still have the confines of pay one, right? Unfortunately, when there's enrollment dates that are prior to what we're trying to fix, there's not a magic button that we can force pay one to do what trying to think of how to say it. It's like um, benefits 24/7 can handle all of this, no problem. However, we do know that pay one has certain restrictions, and we do still have to work within those confines of pay one restrictions. And so there are unfortunately going to still be a few things in which aren't going to be absolutely perfect, in which there might have to be some kinds of interventions with pay one in order to make sure that billing is correct. I wish that wasn't the case, but pay one does have very strict regulations on how and when things could be done. So as much as absolutely possible, we have made sure that benefits 24/7 does appropriately send information, right? Um, almost every single problem that we know of with sub my account into pay one has been addressed with benefits 24/7, but we're still always going to have some of these retro issues like this scenario that you brought up, Tila, that are just kind of unavoidable, and we'll have to work through those. Unfortunately, until there's a different system for invoicing, that maybe we have new opportunities. That it is the kind of current state, I guess. All right. Let's quickly, before I move too far, I wanted to show you guys the manner in which we could make an adjustment to a spousal attestation. So the reason I say spousal, we all know that subscribers themselves can come in and make updates to their tobacco attestations at any point. You can see here for this subscriber that they have that tobacco attestation option on their dashboard. However, if we come up into the tabs, which is replicating how a benefit admin would see their subscriber, and this is HCA, right? So we have the spousal attestations. We also have the notes section. Neither of these will be visible for the benefit admins. But if we go to the spousal attestation page, this is actually spousal attestation corrections. Now in SMA, for those of you who actually look at or have to make changes to an attestation, you know that the only options are yes or no. And that's not actually giving us the correct information on what somebody has actually attested. So we worked really hard on how we could actually make this functional to provide the correct answers. So if I was to come in here and needed to make a correction to a spousal attestation, if there is one already on the account, we would see it listed here and we could expand this attestation. We see the date in which it was done and what the start date is and what the end date is, right? On this person, I did answer no to question 6. So because this is the only one here, it is, and it's already expired. It's not allowing me to make a change. But what I could come in here and do is, one, you could delete it if you needed to. But you could come in here and add a new one if that was necessary. And we could put in the attestation date. So we can just put in today I did this. I did the correction today, but this is actually for 1/1/23. And then I would just come in here and actually answer the applicable question. So for this case, let's just say, you know what, they are no longer eligible for medical coverage through their employer. So we would say no. Where's my save button? That might be a little bit of a bug to look at. Okay, let me write that down really quick. So there should be a save button there, and then you can save that.
Is it on the bottom left
new
there?
attestation. Oh, there it is.
Yeah.
My goodness, you guys. Okay, so I complete my. It's Friday. Complete my attestation and hit save. I don't know why it's giving me an issue there. There shouldn't be. So that is a bug that it wouldn't let me save. But that is how we would make a change to the attestation here. So a vast improvement over SMA. We can actually answer the applicable questions instead of just saying yes or no. Okay. So let me make that note really quick. Keep track of my list. Okay. So now we're going to go into a little bit more light and fluffy things. So first I am, let's walk through a couple of reports, and I do need to go to a different environment because my training environment hasn't been working for my reports. So, and I want to make sure that we can show you guys. So this is the report section. Of course, sorry, I moved a little quick. We can get there through the tile on the dashboard or the navigation here. We have the same filtering options, show only PEB or show only SEB. And that is, there are a couple of reports that are specific to SEB, things like eligibility files, an API submission report. Currently, Seattle School District is the only one using that. So there are a couple of files that are specifically to SEB in here. Also, If we select one of those show only PEB or show only SEB and we continue through to get results, it would only show us results for PEB or SEB program. So allows us the ability to reduce what we're looking at. So there are a number of reports listed in here. Again, apologies that you cannot see this, but we have things like benefit election status, dependents without SSNs, dual enrollment across programs, LTD 90-day waivers for the PEB program, spousal reattestations, and then we have a couple of reports that I wanted to look at. So we have our statewide benefit administrator contact list. So if I select this report, so this is a pretty cool feature that we included that is a little bit different from SMA. This display page, once we select our report, is going to show us all of the fields that are actually on that report. And this is the same for any report that we have. It's going to show us all of the fields that are on the report and automatically is selected all of the fields. But if you only wanted to look at a couple of them, let's just say you don't care about the first and last name, you can deselect those and hit next. And then your report would only show organization, agency code, and contact email. So let me quickly go previous, and I'll reselect that first and last name. So you can see that we get that information. So this benefit admin contact list, this is information that comes from the manage access. So anybody who has been provisioned access within benefits 24/7 would show up on this report. And we would see all of the individuals at those various organizations. So this is where it might be wise to filter PEB or SEB based on what you're looking for. We can also download into Excel. So if I go back to my search, let's take a look at, because we have our ACA folks, let's take a look at our dependents. Actually, let's do all active and not active. And let's just go. Let's run this report all the way back to 2022. We would have we have all these fields on the report, and I'm going to go ahead and select next. And here we would see anybody in the system who did not have an SSN assigned to them. We can scroll over and see what their date of birth is, and then we actually see what coverage they have, if any, on the report and what their relation is. So just wanted to touch base on how the reports function in benefits 24/7. Some of these reports are available to benefit admins as well, but what we see as HCA is a much longer list because we have many more reports available to us. Any questions about reports? Okay.
Since you pulled up that report,
Yeah.
Can the BA still go in and update the dependent's social security number, even though the coverage is no longer active?
Yes, they should be able to.
Thank you.
Yep. All right. So now I wanted to talk about contacts for an organization. So let's just pick on PEB organization here. So here we're going to go to the organization profile. So I am certain many of you are familiar with the old contacts database that Amy manages. We can go in there and we can look up an organization and we can see who the various different contacts are that work at those organizations if we need to reach out to somebody in regards to payroll or benefit specific, we have all of that information in the contacts database. So first and foremost, anything that's already in my account as far as contacts go, and anything that's in the contacts database that Amy manages for PEB, all of that information will be in benefits 24/7 when we launch in May. So none of that will have to be re-entered. However, we know people come and go. And so on the organization profile page, down at the bottom of the page, there is the ability to add new contacts. And this is, I recognize that this is something that we as HCA folks may not be doing actively, but it is very important to relay to our benefits administrators to keep their contacts updated and encourage them, because we as HCA folks use them regularly. So we want to make sure that we have this information in the system. So we come in to add a new contact, we expand that contact record, and we would enter the applicable information. If they don't have an individual address, we can just select that it's the same, and then we don't need to fill that out. And then we have the various contact types that would apply to the individual. So just wanted to point out what this contact section looks like on the organization profile. So I'm just going to click on remove, and then I'm going to move back up here. So let's talk a bit about the information that is on the organization profile, because again, you guys use quite a bit of this when you're reviewing the contacts database. So in here, we would have, or we do have benefits setup. So we'd be able to see full benefits, medical only. We have a contract number if that is applicable, their rate structure, if they have an employer group surcharge, and then if they are part of the state payroll system, HRMS. So again, this is our training environment, so not everything is updated. All of this will be accurately populated when we go live. Another thing to point out here is there is a couple fields that you're seeing here that are new, not something that we've had in SMA before. So we do know that our UW employees and WSU and Pierce County do not actually have the ability to log in to even the current PEBMI account during open enrollment or anytime throughout the year to make changes. So for those couple of organizations that cannot log in to do their enrollment process, their organizations will have this selected. And that just means that those subscribers will get if they try to log in to benefits 24/7, they'll get a notification that they are unable to make changes through this system and to go talk to their HR benefits office. So that is on the PEB side. So you can see that this other option here is grayed out, and that's about locally eligible benefits. That does not apply to PEB. So in recognizing that a lot of the information on this organization profile page, one is already information we have based on current agencies, and two, if new organizations need to be added, Amy or whomever, hopefully she doesn't ever leave us, but that's kind of unrealistic. So if she does leave us, whoever takes over for her and manages those contracts will be the main person entering in this information. But I did want to point out where you can come and find the information about the different organizations. So I want to jump over to a SEB organization and talk a little bit about the locally eligible, because we're going to look at some differences of how SEB-My account works.
Oh, Amanda,
Yep.
before you skip, so this is going to be the new contact database that that Amy used to manage, that we currently have, the contact database, that's gonna go away, right? So this is gonna be the new platform?
Yep.
Okay,
This will
so
be the system.
okay, so the old contact database, we also have notes where it give us information of the original agency code when it's like, for example, agency 300 R04, it was previously it was a consolidation of 300 R03 and R02. So that's a notes in that database. Is that going to be coming over to this
Yep.
platform as well?
They'll be in the notes section as I'm highlighting here.
Okay, perfect. Thank you.
Yep, you're welcome. All right, let's go back to, I am going to pull up the organization here and go to this organization profile. So now you can see the difference here is the subscribers unable to make elections is unselectable, but the locally eligible benefits checkbox is selected. So in SMA, you guys are familiar when you're adding a new subscriber, we have a drop down for eligibility type of SEB eligible or locally eligible. We have had so many issues with people either not understanding or selecting the wrong option and selecting the locally eligible. And then we get fuses and phone calls and saying, why am I being billed so much for this person? And then we have to go fix it, right? So because that's been such a headache, and we also know that in order to provide those locally eligible benefits, those organizations have to actually go through a whole contracting with Amy. So in order to provide those benefits. So if in the case that an organization does provide locally eligible benefits, I think right now there's less than 5 organizations that do. I know Bellevue off the top of my head and maybe Ellensburg. I think we have less than 10 people. So anyways, if the organization was to provide those benefits, Amy would come in here and select the locally eligible. And should let me, okay, and then I submit my changes. So now if I go in, selected the wrong thing. If I go into my organization and I add a new subscriber and put in the date of eligibility here, we see that the locally eligible radio buttons are selectable. So we could say yes, it's automatically defaulted to no, but if they were determined to be locally eligible, we could select yes. And only if that checkbox on the organization profile is selected that the organization provides benefits for locally eligible subscribers. So that's the only difference there. Makes it much more difficult to choose this option. I know it's something that I've done a lot of cleanup on. A lot of you guys have done cleanup on as well. So this should make it relatively almost impossible to mess up, hopefully. So I'm going to go to another organization here, school district. So the other major change that we had in benefits 24/7 as opposed to SEB My Account is how we handle the first day of school. So again, it's been an issue. People forget to go and update their first day of school prior to adding folks to coverage into SEB My Account. I mean, so what we did when we add a new subscriber is instead of requiring one individual at a SEB organization to go in and update that first day of school on the organization profile, we don't even capture that information anymore. We don't even ask them what that date is. What we do is we say, when you're adding the individual, into benefits 24/7. If it's a date, and I am going backwards because it's not going to let me do September of this year. If I add a date 8/31 and select next, you'll see that the coverage is automatically effective the first of the following month, right? That is how SEB program rules work. But if I go back, I'm going to hit cancel here, add new again. If I put in any date in September, a new box pops up. So it is basically forcing the benefit admin to provide an attestation. That's kind of how I think about it in my head, right? The benefit admin is saying this person was hired on or before the first day of school, so their benefits should be effective at the same time. This box only shows up if this date of eligibility is in the month of September. If it's any other date, they'll never see this checkbox. So it's providing that opportunity to, and then if I select the box and hit next, and I come in here, now you can see that the coverage effective is showing and it's matching that date of eligibility. That is a good point. I don't think I acknowledged with you guys when adding a subscriber or any subscribers, actually. Maybe I did last week. We showed the coverage effective date. So that's pretty cool. And then here in the reverse, that locally eligible, this organization does not have that opportunity selected, so I cannot change this value. Cannot say that they're locally eligible since that organization doesn't have that selected. Any questions about organization contacts, first day of school, locally eligible? All right. The last thing on my list for today is I was going to show, go back into the subscriber history because it wasn't quite working when we reviewed it last week. So I'm going to go ahead and select my, don't do this to me. It was just working. What the heck? It worked for me the other day. Oh my goodness, you guys. I was all excited to show you that we could actually see some information and it's not going to load for some reason.
Amanda,
I can show you. Yeah.
you're not going crazy because I also went in, mine were spinning like that, and it was not spinning on one day at one moment in time. And then
Yeah.
it's doing that again. So I don't know what triggers that. So just know that it was working like you thought.
Okay. Thank you for helping me. But I can show you here because this eligibility record has some changes, so we can see a little bit of history here. So this individual started out at Department of Ecology. We can see that eligibility effective end date now. We can see that modified date and time. And then we can see a new organization come in. So I will double check on what's going on here with our history. And I asked for another update into our training environment at the start of next week. So hopefully some of these issues will resolve themselves again. So sorry, I don't have more information to show here, but we'll get this working.
Okay. This Tila, I was also excited to be able to see the history because I wanted to see if in the history does it show original agency code history that's under self-pay, like if self-pay is staff keyed in an incorrect original agency code and then it changes to a new one. I was interested to see if that's in the history.
I am not sure. I would have to check on that. All right. Well, that was everything I had on my list for today. So I am happy to take additional questions, or you're welcome to have some time back in your day. Any questions?
I have one question, Amanda.
Yeah.
On the special open enrollment, just the kind of the procedural actions that would be required within the 60-day time frame that folks are stuck with, being a fellow procrastinator with many of our enrollees. If I'm coming in at the last minute and I submit a special open enrollment and I go through the whole thing and submit it, and my benefit administrator is out for a vacation for a week, and I'm in a smaller district or something, maybe there isn't a backup. Am I stuck? Like, if I realize I wanted to change my plan when I added the dependent, even after I've hit the go button that kicks it to my benefit administrator, can I go back in and at least change it? Or am I stuck waiting for the BA to, bless that or something, to
Your
where I
60
might,
days has expired at that point?
well, like, say I do it on day 60, right?
Yeah.
And so I'm waiting. If I realize on day 60 and my BA isn't there to like your example where you said, oh, do you go in and say, oh, I needed to change my plan? If my resource isn't available, is there any way that I can kind of preserve my opportunity for the SOE within 60 days alone? Or once I hit the send button, am I kind of stuck waiting for the BA?
So
Does
if
that make
you've
sense?
yeah, I think I understand what you're saying. And the short of it is you need to wait for your BA, right? Because once your 60 days is over, you're not going to be able to make changes. So you need to get it submitted within that 60 days. The benefit admin still has Jeff, please correct me if I'm wrong, but I know one of the changes that we incorporated into benefits 24/7 versus SMA was benefit admins will have the lower limit based on the coverage effective date of the SOE, which hasn't always been the case in SMA. So even if they were out, for a week or whatever, they could come in and still make impact to that special open enrollment on your behalf, as long as, per rules, as long as you're following rules and policy and all of that. We don't know what goes on behind closed doors with subscribers and benefit admins, but if you did all of your due diligence and submitted the information to them, they could make that change on your behalf.
So if I submit a form to add a newborn, but I don't say anything about the medical coverage, and I hit go, and now I'm prevented from adding the medical coverage in my SOE request, and the BA gets back in 2 weeks because they were on vacation, and I say, oh, I also wanted to change my medical plan. I mean, technically, I'm 2 weeks past my 60-day limit for an SOE.
Well, so with SOEs too, just because you submitted it doesn't mean that coverage is in place. So for an SOE, basically, once you've submitted as a subscriber, it's being held essentially until that benefits administrator approves it. So even though you've submitted it, until somebody comes in and completes that verification, your coverages aren't going to be sent to the carriers, because that event has to be verified, right?
Yeah.
And so that's where I'm saying they would have, as long as you did your due diligence of, within the confines of the rules, to tell your BA what you meant to do, they could come in and make that change and then verify the event for you. But until the event has been verified, those coverages will not get sent to the carriers or.
Yeah, I understand that piece. Okay,
Yeah.
thanks.
And just a note on that one, if you've submitted today and it was the last day of your 60 days, and today you realize that, oh man, I should have put a plan change on that SOE, you can't change that SOE, but you can delete it and log a note.
Yep.
That's what I'm wondering.
Yeah,
I would have a route to go in and delete my original request, and within the 60 days, submit a new one that had both of my actions defined.
Correct. And so the key in your scenarios, if today was your last day of your 60 days and you submitted it and realized it today, delete it and submit another, because that submit date is important. If you found out after your 60 days, then I would probably tell the subscriber, leave it out there just so they can see the submit date on that one, and then we can adjust it when they get back. We could still dig into the records that says you did submit an SOE associated with that within your time frame. As far as an audit kind of process worked, sure. But if you caught it today, you could delete it and just submit another one, no problem. If you didn't catch it until tomorrow and it's the 61st day, I leave it there and then work with your VA when they get back. Hope that helps.
Okay, thanks.
Yeah, man, I just want to confirm one thing. Under the Manage Access tab, only a person with admin access can release that account, correct?
Under the Access tab.
Admin
Manage
or
access.
Say that again, Jeff?
are you talking about benefit admins, Robert, or are you talking about HCA?
Yeah, benefit admins.
Benefit admins with edit or admin role will be able to release a subscriber account.
Not the read only.
Correct.
Okay.
All right. Any other questions?
This is Tila.
Yeah.
So on that correction, SOE correction, HCA correction example, so I know that when you make any corrections, you need to make a note. If it's a correction
Oh,
in
yes.
24/7, you need to make a note. And there was no mention of that, but I think that you mentioned that in the earlier training.
I did. Yep.
Okay. So on that example of the HCA correction, I know this is a very tutorial, which is great, where it goes through the different steps. So is the final step takes you to the note to make the notes, or does it rely on the staff to go into the click on the note to do that?
Yep. So it would be the same, like you actually have to go into the 58 screen. It doesn't take you automatically there. You would have to go to the notes section to add the note.
And there's no way to make it just go after that. That's your final step, is to take you to a note, and you can make a note without having to click to a different tab for 24/7 for make it easier for the staff.
As one of our favorite sayings goes, with enough time and money, anything is possible. So if that's something that business feels that would be extremely helpful, we could definitely take that enhancement request and get it prioritized. But it would not be something that would be available on May 8th when the system goes live.
Which I understand. And so, and again, I just want to make sure that the notes that we put in there is only visible to HCA and not to the BA or to the employee or the member, right?
That is correct.
Thank you.
All right. Any other questions?
Amanda, this is Angela. In a quick question about kind of how error correction works. So if think like late notice of eligibility for on the either side, I guess, is that calendar that shows up? I think you're on your SOE screen when it shows up. Does it allow them to go back further than the lower limit, or is that like grayed out?
For a subscriber.
Like if the BA was going to go in and add someone, let's say that they were originally eligible or a new hire on, November of 2021, and they didn't notify them at that time, and they're just reaching out to us, today or whatever. Sometimes we have, let's say, school districts that will go in and just try to enroll them anyway. And fortunately in the system, they wouldn't be able to go back past the lower limit. I'm just wondering if this new system will kind of be the same.
Yep, lower limit is already applied in benefits 24/7 for benefits administrators.
Okay, great, thank you.
Yeah. Any other questions? Well, I will stick around if anybody wants to chat in a smaller setting. Happy to do so. Otherwise, thank you all for attending. Have a wonderful day and a great weekend. Thank you so much.
Thank you.
Thank